and today we will be discussing Bluetooth pacemakers, a closer step in connecting patients and their cardiac treatment. Our group members are Nicole Adams, Orpheus Cardona, and Carla Guris. Let's first discuss what Bluetooth pacemakers do and how they differ from traditional pacemakers. The first successful pacemaker was implanted by William M. Shardak at the VA Medical Center in Buffalo, New York in 1960. Since then, we've come a long way in technological advancements, and pacemakers that utilize Bluetooth technology are now available. The first smartphone-compatible pacemaker was launched in 2018 and has only grown in popularity since. But how do they work? Both traditional and Bluetooth pacemakers function similarly in that the device installed allows for the treatment of an abnormal heart rhythm, a condition known as arrhythmias, and keeps the heart in sync. The difference between the traditional pacemakers and Bluetooth pacemakers is in how information regarding heart rhythm is recorded, as well as determining if the device installed is functional. Bluetooth technology allows physicians to remotely monitor the cardiac status of their patients who have received a compatible implanted pacemaker. The data collected by the pacemaker is transmitted to an app on the patient's device and forwarded asynchronously for the physician to review. Traditional pacemakers require patients to visit their physician regularly to ensure that the technology is functional. Older pacemakers also do not record information about the patient's cardiac rhythms. This antiquated technology drives healthcare expenditures by increasing the cost of transportation for the patient and adding the cost of multiple clinic visits per year. Additionally, the lack of information storage can lead to missed information when a patient is unaware of an irregularity that occurred or simply forgot. Bluetooth pacemakers encourage patients to actively participate in their own healthcare by monitoring their own cardiac status and regularly transmitting the information collected by the device to their physician. Some Bluetooth pacemaker applications, like Medtronic's MyCare Link Heart, have an option to schedule the forwarding of information so patient responsibility is limited. With Bluetooth remote monitoring, patients with these cardiac devices may only need to visit their physician once a year, which is a significant advantage of this technology. The reduced need for face-to-face visits with a physician makes Bluetooth pacemakers and remote monitoring a valuable tool for individuals in rural areas. Now we will discuss currently available models of Bluetooth pacemakers and how they can improve healthcare in America.
All right. So current models of Bluetooth pacemakers include Medtronic MyCare Link Heart and Abbott Gallant ICD. Expanding on MyCare Link, the device functions through way of a similar function to a mobile app that allows for remote patients monitoring of BlueSync-enabled CIEDs. As we see from this infographic, the Bluetooth pacemaker allows individuals to keep track of not only their vitals, but other information such as physical activity and any symptoms. We see how the Bluetooth technology within the pacemaker sends vital information to the patient, first as a pass-through and is then sent to a CareLink network. The network will then send information regarding their cardiac health back to the patient on the app. The advantage of this is that patients receive informed and filtered information of their health in a way that is understandable to the patient and is not simply raw data. Another example of this is going to be the Abbott's Gallant ICD function, that functions similar to Medtronic's by sending information collected by the device to a smartphone app called My Merlin Pulse. In the smartphone app, patients are able to view their own data, monitor the functioning of the device, and transmit data to their physician. Next up, we will be discussing how Bluetooth pacemakers have improved healthcare.
Okay, so a benefit of remote monitoring is that with this technology, it makes healthcare more accessible and affordable for residents of rural areas. The maldistribution of physicians in the United States has made healthcare significantly less accessible to residents of rural areas and has driven up the cost of transportation to see a physician. Therefore, with the implementation of Bluetooth pacemakers, patients have had less accessibility to physicians that are now able to use remote monitoring of cardiac health, given that they have access to Wi-Fi. There's been a steady increase in the number of patients with CIEDs, or cardiac implementation electronic devices, imposing a significant burden in the already limited resources arising in their follow-ups in their outpatient clinics. Having remote care offers an opportunity to resolve some of these challenges associated with the delivery of effective follow-up by improving efficiency and patient engagement. Another benefit is having the economic impact for both patients and physicians. A study that examined this showing that with app-based cardiac monitoring with cardiac devices, it found that within the population they were studying, that there was over a 56% drop in ambulance visits, plus a 60% drop in hospitalizations. Both the patient and the hospital saved money with these visits, and it showed a smaller incident rate of patients needing to see health professionals because they're able to monitor their own health and able to connect the information with their healthcare professionals. The advent of Bluetooth pacemakers have been found to increase productivity among staff or patients that use pacemakers. According to a study found in the Journal of the American College of Cardiology, wireless remote monitoring with automatic clinician alerts as compared with standard in-office follow-up significantly reduced the time to clinical decision in response to clinical events and was associated with a significant reduction in mean length of hospital stay. For patients who do have to utilize pacemakers, the usage of Bluetooth pacemakers keep patients out of the hospital for extended periods of time and consequently allows patients to have a quicker understanding of what is going on with their health. So for some recommendations with Bluetooth pacemakers, there's one disadvantage to those which has been mentioned earlier in the video, but that is because the information on the pacemaker is provided to the patient, given the patient has Wi-Fi or data. This is a little bit iffy because patients that live in rural areas where Wi-Fi usually is available now is limited, and these patients are not able to inherently read the benefits of these apps are connected to these Bluetooth pacemakers because of not having accessible Wi-Fi. Another issue would be in order to have these Bluetooth pacemakers become successful, it has to be taken into consideration that the demographic using these are usually not the strongest with electronic mobile devices. For example, someone who's older probably wouldn't have a difficulty adjusting to having a pacemaker that has connection to their phone. So with this in mind, we would probably a good suggestion would be to train their healthcare professionals or in nursing homes or assisted living to be able to help teach these older people who are using these pacemakers how to use the apps that are with these electronic devices. And now we'll talk about the discussion questions.
All right, now understanding Bluetooth pacemakers, we bring to the floor the questions that with the development of technology moving to Bluetooth capacity, what other medical devices have the potential to capitalize on Bluetooth technology? And our second question is, do you believe that at some point the use of traditional pacemakers will become obsolete in light of Bluetooth pacemakers, or will we continue to use traditional pacemakers to some capacity and why?